We've entitled this section of the presentation, Targeted Patient Care. In this video, you will hear from a basketball pharmacy patient and caregiver about her experiences with medication synchronization and medication packaging, and how these have helped her better manage her family's medications. Michelle Farrell, owner of Basketball Pharmacy, also discusses why and how they provide these services. Next, you will hear from Andrea Wood at Good Value Pharmacy in Kenosha about her experience this spring and summer participating in a short proof of concept pilot with WEA Trust, a statewide insurance plan. Through the Wisconsin Division of Public Health, WPQC was provided a grant from the Association of State and Territorial Health Officials, or ASTO, to coordinate the provision of hypertension-focused comprehensive medication reviews with a health plan. We partnered with WEA Trust and 6 WPQC pharmacies to provide comprehensive medication reviews to WEA members on medication to treat hypertension. The pharmacies that participated in this pilot clustered in Kenosha and Sauk counties. At least one pharmacist from each pharmacy participated in a training webinar focused on logistics as well as available hypertension-specific and adherence-specific resources. Unique to this pilot was the use of a multifaceted marketing approach that involved both WEA and pharmacy outreach to patients, along with incentives for both pharmacies and patients. The response rate was fantastic. 59% of the eligible patients agreed to the visit, and 100% of those 36 patients completed both visits. The pre-post survey demonstrated that between the first and second visits, patients increased their use of the blood pressure monitor and tracking log at home. The last service highlighted in this section is the Tobacco Cessation Collaborative Practice Agreement that Basketball Pharmacy has with Gunderson. It covers not only nicotine replacement, but also bupropion and varenicline. You'll hear how one collaborating physician regards the services provided at the pharmacy.
My husband takes quite a few medications, and then I take about half of what he takes. So what they do is, it may take several months, but they try to get all of your medications synced at the same time, so they come due and they get filled at the same time, so you're not making multiple trips into the pharmacy, which is nice because it's 10 miles round trip for us to come into the pharmacy.
In doing that, we don't wait till that day they need to pick up. We try to do it preemptively, so like 5 to 7 days early, which really allows the pharmacist to review a profile and then maybe ask a technician to schedule an MTM appointment or immunizations if they're qualifying or in need of those types of services. So it gives us a chance to really do a profile review. So with the MedSync program, we're able to detect when patients are not taking their medications as prescribed. We're able to intervene with the providers to say, maybe this is a patient you want to refer to our medication packaging program. And that's worked really well for us as a kind of a natural progression through life in our pharmacy. So
Michelle told me about this MedPack program, and I was so thankful about that because I have a hard time keeping track of all my medication, and there is no way that I could keep track of all of hers. I do try to go to all of her appointments with her, but with having the MedPacks, it's taken a lot of pressure off of me as her caregiver.
After we met and really discussed what the goal of this program was, to make sure that they understood how to take their blood pressure and what that meant. And for some patients, we really took it a step further. If they had diabetes, let's tie that into your blood sugar. you know, we're taking your blood pressure, let's take your blood sugars, you're supposed to be doing it anyways. And it's a lot easier to change some activities in your day, you know, your diet and exercise, if you're seeing that what you're doing is making a difference.
I thought it was really in-depth, really nice. She had a lot of great suggestions for me. I went home the first time with a list of goals for myself, with a beautiful blood pressure machine. I was floored when she said, "I'll contact your doctor and we'll get her, see if how she feels about increasing this medication." I mean, I've never, you know, other than calling a prescription in or whatever, I've never known that pharmacists necessarily can communicate with your doctor.
So the response was incredible. I think even the patients who understood what their blood pressure should be and already led a healthy lifestyle, they loved the idea of not guessing that it's good and actually taking it every day and seeing that it's good. It does really make a difference to have them here in person. Surely to, you know, give them the blood pressure meter and first of all make sure they know how to use it.
Right now, but I would definitely recommend other people to it. I was pleasantly surprised. I basically came in and thought I was going to be here 20 minutes and she was going to look at my meds and say, okay, everything's good. It was far more than that.
Within the practice, we've got a few different collaborative practice agreements, and our impetus on establishing those agreements is to take better care of our patients and really highlight the need for good medication management.
And sometimes people actually walk into the pharmacy, which I didn't even realize that was happening until Michelle brought it to our attention. That sometimes patients walk in and are just like, I want to quit smoking, help, you know, what can I get, what can I use? And so we realized that there's kind of a disconnect between where patients were trying to get the things that they needed to help quit smoking and the fact that it wasn't always in our office with us, but often was much more spontaneous.
I can't tell you how many times over the last 18 years I've heard, well, I wasn't really thinking about it when I talked to the doctor, but now that I'm at the pharmacy and you're saying the same thing, I think I'd like to talk about it. And I've always had to say, well, I have to get a prescription for you to get it through your insurance. And now having some of those providers giving us the ability to make the recommendation for the patients and actually fill the prescriptions has been really beneficial.
Each one was in there. Like, I've never had a pharmacy before call me and say, by the way, so-and-so was in and they didn't look really good. Can you reach out to them? I've never had that experience before. And so I like to think that we have a really good collaborative relationship that kind of goes both directions. I can recommend some of the services that are available for, say, my patients who can't take their medications well. You know, they can get them med packed there. Like, I can make those recommendations, and they can also send some recommendations back my way. You know, I saw so-and-so, or, hey, by the way, while so-and-so was in, we talked about this or that. And so it's been really, really good. They do way more counseling than I have ever seen a pharmacy do, and so they can really be an extension, I guess, of our clinic as people are picking up medications for their different